I'm Dr. Hardik Soni.
Hi, I'm Dr. Lana Cheuck.
And today we want to talk to you about PepFactor for skin and scalp rejuvenation. It's a proprietary blend of peptides that can really help improve your service offerings in your aesthetic practice.
It's been amazing for our patients. I mean, it's really been booming. PepFactor is out there. Our patients are asking for it. Physicians are asking for it. All the other injectors are asking for it. We're really excited to be offering this to you guys.
So come join us and let us show you how we can help incorporate this into your practice. Thank you.
Okay, so now to the protocols, which is the funnest part of this whole thing, right? You want to get those patients coming in. You want to establish a good rapport with those patients. So for PepFactor Skin Rejuvenation, what you're going to do is you're going to have them come in once a month for microneedling. Okay, so you're going to reconstitute this single use and you're going to microneedle it into their skin. Now there are times when patients have a little bit more kind of acne and deep scarring. You may want to do 4 treatments, but our protocol is 1 treatment per month and then maintenance after that, right? You want to make sure they come back in for maintenance, and our maintenance is typically quarterly or every 6 months for skin rejuvenation. For scalp rejuvenation, that is going to be amazing because you're going to have those patients come in every 14 days, so 10 to 14 days, and you're going to have them do 6 treatments, which is amazing because they're going to get the optimal growth after 6 treatments of PepFactor for scalp. So we have them come in 10 to 14 days times 6, and then maintenance treatment after that every 6 months or so. So let's talk a little bit about the contraindications for PepFactor skin and scalp. They don't differ from any other contraindications for any topical skin microneedling. For instance, active infection over the site of microneedling is contraindicated. Pregnancy, lactating women, breastfeeding women, and also those who have active skin cancers in the affected area are not candidates for skin and scalp PepFactor.
So how do we provide adequate anesthesia for PepFactor skin and scalp since it is used in conjunction with microneedling? For the skin, typically we use a topical benzocaine, lidocaine, tetracaine solution, or whatever topical solution you're presently using. You would apply it for 30 to 40 minutes prior to the treatment, very similar to prior microneedling, which you would have performed. For the scalp, you can also use topical products, but there are other solutions such as local nerve blocks, including supracochlear, supraorbital, greater and lesser occipital nerve blocks. In addition, if you have a nitrous system like Pronox or Nitronox, that can tremendously aid in performing this treatment. However, for most patients, these treatments are very manageable, and you can simply use a localized chiller like a Zimmer or a vibratory device.
Okay, so let me show you how we reconstitute PepFactor for skin and scalp. Let's start with our skin PepFactor first. Again, these are stored at room temperature in our cabinets. What I'm going to do is pop off the top, and you can see how easily this pops off. And then the actual PepFactor itself also is a flip-off top as well. And then you're going to then peel off the top of this easily. Once those are peeled off, you're going to take off the cap. And again, this is sterile. And we're just going to simply mix and reconstitute your hyaluronic acid into the PepFactor. Then you're going to recap the PepFactor with your hyaluronic acid and recap your hyaluronic acid tube, which is nice because sometimes you do get a little bit left over, but you're going to use 1 single use for each patient. You have this really nice thick hyaluronic acid, which is perfect for topical microneedling. And so for that reason, you really have to reconstitute this well by doing a little bit of mixing, going back and forth like this. So once you shake it, and you don't have to be too worried about, gentle shaking, you're going to get this really nice suspension of your PepFactor with your hyaluronic acid, which is going to be perfect for topical microneedling. Let me show you how we reconstitute the PepFactor for hair restoration, where once you pull it off, and then we're going to just peel that off gently. And again, we're going to take off the top. And again, this is sterile. We're going to go ahead and reconstitute our copper peptide mixture with our PepFactor. We then recap, again sterilely. And as you can see, it's already a beautiful, nice, homogeneous suspension of your reconstituted mixture of PepFactor and copper peptide. So here we are demonstrating on this beautiful patient what PepFactor skin microneedling looks like. As you can see, she's very comfortable. We had given her some topical numbing for about 20 to 30 minutes, and we're using our M8 pen, microneedling pen, and as you can see, we're getting some nice kind of erythema and pinpoint bleeding, which is what you want to see as an end result with our PepFactor. The PepFactor has already been mixed, and in that beautiful suspension that you see, it's been drawn up with a syringe of any size that you prefer. And this is typically microneedled into your skin at varying depths. Some of the depths that we start off with can be as shallow as 0.25 to 0.5 millimeters. And in certain areas where there's thicker skin, in areas that she's going to need a little bit more textural improvement for the rejuvenation of her skin, we can go up to 2.5 millimeters of depth.
Yeah, and another thing I want to point out as well is, this diluent that we mix the PepFactor in, the hyaluronic acid serum, it has a wonderful thickness to it. So if you see, when I put a couple of drops in there, it gives me a little bit of time before it runs all over the face. And that's kind of very important. Some of the other serums that are used are really runny, and it's going to start running. And the second thing is, in general, your endpoint is really this pinpoint bleeding or a slight amount of redness that you see developing. And usually you can get that in about 4 to 6 passes of that area. And certainly if you are going to treat the under eye circles, you want to use, more shallow depth just because it's a sensitive area. Or if you're doing the forehead, again, you want to use a little more shallow depth because it does tend to be a little bit more sensitive up on the forehead.
So one of the things that we love teaching our injectors and physicians is after we numb the patient topically, we have them wash their face, and we really clean their face and sterilize their face very well. So our whole face has been wiped down, and alcohol is typically used, although we can use other things like Hibiclens. And what we do is we typically like to start on areas that are most sensitive. So like Dr. Soni said, sometimes we'll start on the forehead and maybe upper lip and sensitive areas such as under the eyes, where you have to be a little bit more shallow. And the technique that we use is the technique where you really just want to get good surface area with your microneedling. And that's a gliding motion. Sometimes on the scalp, we can do kind of a punch motion in and out, but we can do circular motions. There's the punch motion. We can do up and down, left and right, and diagonal to really get the whole surface area of the skin. And what they'll typically see is the PepFactor, given its rejuvenation properties, her skin is going to look brighter afterwards, and the erythema will subside usually in about 24 to 48 hours.
And if you can just take a look at that area, and this is really kind of our terminal endpoint. We, especially if we're just looking to rejuvenate the skin and improve the tone and more superficial textural issues, then you really just want to see a little bit of this pinpoint bleeding, a little bit of this red flush, and that's going to be our endpoint. You're certainly going to reach that endpoint a lot quicker on bony areas like the bridge of the nose, as well as the forehead itself. So you don't need to do as many passes. Probably 3 to 4 is more than enough. Here you can see I've only done about 3 passes, and you can already start to see a little bit of that redness and pinpoint bleeding develop and these are the endpoints. Thank you. We're going to show you how to do the PepFactor on the scalp now. Now, there are several areas you can treat the scalp. You can treat the frontal temporal parietal region. Oftentimes, there's a little bit of reduction in hair in the vertex, and you're really going to be going at a minimum depth of 1.5 millimeters. Now, you can use whatever anesthesia you prefer prior to performing this, whether it's a topical anesthetic, whether it's a local nerve block that you're doing, or whether it's a combination of a cooler or vibratory device, or a nitrous system that you're using as an anxiolysis. So here we're going to just do the frontal temporal parietal region, and this is the PepFactor for scalp. So this couple drops, and you're microneedling in this area as at the aforementioned depth of 1.5 millimeter. And what your end point in this region is you want to see pinpoint bleeding develop.
Now, in some patients, when they have a little bit longer hair, if the hair does tend to drag a little bit, what you do is you can do kind of like a punch technique where you're just kind of stamping. So the stamping technique is also used for scalp rejuvenation with our PepFactor as well, with our microneedling pen.
And as you can see, once you've kind of elicited a little bit of pinpoint bleeding, there's a little bit of redness at the site, that is your endpoint. And the combination of the gliding motion as well as the stamping technique may need to be employed. Certainly at some of the deeper depths you may be using, it may be difficult to glide across, whereas stamping technique may be more beneficial, and you're doing it about 4 or 5 times to reach the terminal endpoint. Thank you.
So these are the benefits of PepFactor. It's non-surgical, there's minimal discomfort, there's no blood draws, it's natural scalp rejuvenation, it is affordable and effective, you get long-lasting results, it's fast, hassle-free, and the results are noticeable within the first couple of weeks from your first treatment.
So let's talk about the aftercare instructions after you've done a PepFactor for the scalp treatment. First, it's very similar to PRP for the scalp. You're going to recommend that they don't wash their hair for 8 to 12 hours. Secondly, there are adjunct treatments that you can combine with your PepFactor scalp treatments to make sure they get the maximum results possible. One of the treatments is going to be this low-level laser therapy helmet, which contains 272 LED lights at 678 nanometers. This is the optimal wavelength for enhancing your hair results. Secondly, you can certainly combine it with topical solutions such as minoxidil and anything else that you would have used in the past. The combination is certainly not required, but will enhance the results that are already going to be spectacular from the PepFactor treatments. Thank you.
So very important to give your patients the best post-care instruction follow-up as well. Post-care, what I do sometimes, we do have a little bit of that hyaluronic acid left over. I do administer that on the face afterwards and just give that to the patient to use at home. I tell them do not wash their face for about 8 to 12 hours. Typically what that means is that they can wash their face later that night or just leave it until the next day to wash. But post-procedurally, I love to give them the EGF mask. And the EGF mask found on Facemedstore is so great because it really helps to reduce some of that redness that you see afterwards. So typically even that night or at latest the next day, they just have a nice little pink glow. One of the things that we love to pair with our treatment of post-procedure microneedling with PepFactor is our amazing LED light for your skin. And so what we typically do is have the patient go under this light. It has 4 different settings, 4 different LED color wavelengths, which is best for rejuvenating your skin, helping to heal angiogenesis, decrease bacterial growth, and that's what we use for our post-care. Also, for post-care instructions, make sure you stay away from anything that's going to be too caustic to your skin as it's healing from your PepFactor microneedling. So things like chemical peels, retinoids should be held off for at least 2 weeks' time. And remember, don't forget your sunscreen.
So we'd like to discuss the results of the PepFactor treatment, both for the skin and scalp system. The results from PepFactor for scalp are nothing short of phenomenal. Most clients are going to require 6 sessions spaced out 10 to 14 days apart for optimal results. And most will begin to see an improvement in the quality and thickness of their hairs within the 2nd to 3rd treatment. We also recommend, after they've completed their initial series of 6 treatments, that they do continue on a maintenance plan and get 2 to 3 treatments every 6 to 9 months to maintain their gains.
Here are some amazing before and after photos of our patients who've undergone treatments with our PepFactor Skin Rejuvenation. And as you can see, a visible improvement in their tone and texture of their face, which will give you the best skin ever.
PepFactor is an exciting new development in the field of aesthetic medicine. As you can see from the previous presentation, that it will really add a tremendous amount of benefit to your service. One of the most important things is that you don't need to invest in a lot of capital equipment, number one. Number two, you don't have to deal with messy blood draws or blood processing kits or the PRP kits. Number three, it can increase your revenue stream by as much as $500 to $600 per treatment. It's an exciting new product that's going to complement your existing services in a perfectly blended way.
Absolutely. We are so excited that we've been offering this now for the last 6 months. It's helped us grow our business, and I cannot wait until it does the same for you.